Joining us now, Shae Hutchinson, a CAST faculty member and also Children's Advocacy Center's program with Canopy Children's Solutions. Shae, good to see you.
Good to see you.
Yeah, thanks for coming on.
Absolutely.
So, full disclosure, I am honored to serve on the board of Canopy Children's Solutions. What a great program is provided by Canopy, and great organization, great work they do. And a fantastic board we have as well.
Sure do. Amazing board members.
I mean, it really is good. So, but appreciate you coming on. We're talking about the child advocacy studies, of course, and it says you're a faculty member. Tell me about that.
I am.
Yeah.
So about a year ago, I started teaching the child advocacy studies classes at Mississippi College in Clinton.
Okay.
And we are about to complete our first cohort of 7 students who will get their CAST certificate.
That's pretty cool.
Yeah.
Yeah. So I was asking Keith Stovall earlier from Colin Community College, of course, have a similar curriculum at the community college level. What sort of person enters this line of work? This has really got to be a calling.
It really is a calling to work with children of any kind,
Yeah.
right? But what we know, and it's become more real in the last few years, is children are suffering. Where we're all suffering, but there's a lot of trauma happening, and I think people just want to help. So people are called to the helping field, but then there are those professions who may not realize what is actually happening with children. There's about 1 in 7 children who experience some type of maltreatment nationally. 1 in 5 children have a diagnosable mental health disorder. 1 in 10 have suffered some type of sexual abuse. So it's an issue for all of us.
Startling statistics. That just sounds ridiculously high, honestly.
Mm-hmm. Absolutely.
I mean, almost to the point of being scary, because the future of our nation, of our society, of our globe, depends on stable, successful, productive children becoming adults, essentially.
Absolutely. Which is why we need early intervention when children do experience some type of maltreatment, and to work with the families when possible to keep the family together and to help them become healthy and to thrive. Which is really the intersection for me where Canopy and the Child Advocacy Centers really intersect.
Well, that's what I was going to ask you. How do they integrate here? How do they work together, or do they work together?
Absolutely, yeah. Absolutely. So Canopy has our South Mississippi Children Advocacy Center on the Gulf Coast, and we also have a location in Pascagoula. Yeah. And we've had that Child Advocacy Center for almost 10 years now that we've been operating that. We just last year served over 1,000 children that have come through for forensic interviewing and then referred on for mental health services, medical services. And a lot of times Canopy has the privilege of serving those children long-term through our continuum of care with outpatient clinic services for behavioral health and to support the families.
Are there sometimes some overlap in the situations that Canopy deals with children, and the situation that I know we operate the child advocacy, but I guess what I'm trying to say is, are children subject to being abused and also having some of these other problems
Absolutely.
as well?
Yeah. Absolutely. A lot of times that's the precursor,
okay.
Right? The trauma that is endured. Even it may not be physical trauma; it could be emotional neglect.
Okay.
That really impacts the development of children.
That makes sense.
Yeah.
Which is something more that Canopy addresses in its typical services.
That's right.
Yeah. Well, that makes total sense. So, do you see an expansion of that relationship between Canopy and the Children's Advocacy Center?
I think for child maltreatment in general, that is where Canopy is. Yeah. We're about kids, helping kids thrive, and really getting upstream in prevention. We don't want any child to suffer. Nobody wants a child to suffer any type of maltreatment.
Sure.
Canopy is really leaning more in the prevention area of really working with those families before CPS ever gets involved to offer support, to give them resources, to provide parenting classes, to help them have skills that they may not have had when they were kids.
Shae, the statistics that you cited earlier that I honestly are just remarkable. In my view, are we trending in the wrong direction here, and is there a cause for that?
I think the trends have. I can't speak to the trends. They've been. I know on the behavioral health side, the trend is swinging up, which is not a good thing.
Right.
And I would imagine the same with child maltreatment, and with the pandemic, that really escalated a lot of issues for families. It impacted the stress. And oftentimes, unfortunately, that's taken out on the children.
So that would seem like, and we got to go, but that would seem like that means we got to do more to prevent these situations.
That's right. Exactly.
Yep.
Exactly.
Appreciate it, Shae.
All right. Thank you so much.